All right, good afternoon, everybody. I'm Jayatri Das, Chief Bioscientist here at the Franklin Institute. And thanks for tuning in to one of our live Facebook conversations today. This one is part of my new series, Future of Health, where we're thinking about all of the ways in which science and technology and our society interact with each other to shape the health of ourselves and our communities. And today I'm really excited because we have a special program that's focused on the health of the millennial generation. And so, I'll confess that I'm just a little bit older than the millennial generation here, but I've got a great group of people here, some of whom are millennials, to give us both their professional and their personal experience as part of this very important generation in our population. And for those of you who are listening in today, if you're a millennial, we welcome you to share your personal experience in the chat. Tell us what's on your mind about your health. And again, for those of you who are out there in the healthcare workforce, we'd love to hear about your experiences as well. So before we get into our conversation, I wanted to start just by getting us on a level set here in terms of how we define the millennial generation. And so we define that by people who were born between the years of 1981 and 1996. And that's become the largest generation among the US population. So it's a huge group that we're talking about in terms of, the people who make up our communities, but also the people who are shaping the future of our community and our country. We know that millennials are better educated than previous generations in the US population. But we also know that it's been a really challenging growth time for millennials, all the way going back to the recession and now, what we've been through with COVID. And so what we're going to focus on today is thinking about how all of those factors are revealing themselves in the health of the millennial generation and the impact that's having on, on everybody at an individual level, at a community level, and at a more systemic level. And so I'm excited to be joined by a fantastic group of people who have been thinking about this problem in all different ways. And we came together actually through a really cool project called the Well City Challenge here in Philadelphia. And I'm excited to talk more about how that project came about and what that project is trying to accomplish later on in our program. But let me give you a quick introduction to who's joining us today. So first, maybe each of you can wave as I give you a very quick intro here. Kurnika Gupta is the Corporate Strategy Initiatives Manager at Independence Blue Cross. Then Lauren Nestler is the Chief Communications and Strategy Officer for the Public Health Management Corporation. Alonzo South is the Senior Director of Community Engagement at the Children's Hospital of Philadelphia. And last but not least, Nick Frontino is the Managing Director of the Economy League of Greater Philadelphia. So it's really cool how all of you bring different perspectives to the problem. And I'm excited to share your perspectives with everybody. So Kurnika, let's start with you because some of the work that Independence Blue Cross and Blue Cross Blue Shield has done is really at the foundation of what we're going to talk about today. And this discussion was really generated by a study of millennial health that Blue Cross Blue Shield did a couple of years ago. So I'll start out by asking you to share a little bit about how this study was done, and then we can talk about some of the high-level data and the trends that emerged.
Great. First of all, thank you so much for having me. I'm really excited to kind of be a part of this effort today and raising awareness and highlighting millennial health and mental health. So important. So as you mentioned, the Blue Cross Blue Shield Association has a program called the Health of America, and they pick a wide variety of topics to study each year. It's been going on for several years, and they use claims-based data to inform their reports. And so for this particular report that came out in 2019, early 2019, based around millennial health, we had 55 million Americans, claims data from 55 million Americans was included, and the findings were presented in that initial millennial health report. And then in a few minutes, we'll walk through kind of what that showed. And we had such an incredible response from the findings and just pure shock, I think, from so many people that it became a very big interest for us here in Philadelphia at Independence Blue Cross, because we saw a great impact on our community. So we decided to take it on as a very kind of specific effort for ourselves. And that's what led us to kind of developing the Well Today Challenge hand in hand with the Economy League of Greater Philadelphia. And the Blue Cross Blue Shield Association had increased interest as we kind of entered into a pandemic and the effects of mental health, especially on millennials during that time. And so a second report, mostly like a refresh, but focused on behavioral health, was launched in October of 2020. So we can walk through the data now if you think that's best.
Yeah, and before we get into that, we've got a comment here, from somebody who says, like, it seems like everyone under the age of 40 has anxiety and or depression, and that's a really perceptive observation. And we're just about to get into the data that supports that anecdote. So thanks for sharing that. But before I pull up these graphs, though, I just to make it clear for everybody kind of where this data set is coming from. I mean, this is actually really interesting to me, that that these are anonymized data, right? Because it's we're not assigning these to individuals, but because such a huge number of Americans happen to be insured under Blue Cross Blue Shield policies, we've got this enormous data set to look for trends. But at the same time, Kernik, as we were talking about this earlier, one important thing that you mentioned is that these trends are only for people who have insurance. And so, one of the things we can talk about is, what that means in terms of how far, we can, interpret this, these data for the rest of the population who may or may not have insurance as well. So that's one thing to keep in mind as we think about the trends that we're looking at.
Yeah, and I think just kind of piggybacking on that point, if we were to include, everyone in this, insured and uninsured, we would probably see these trends tenfold. We still have a large population that's uninsured in our nation, and especially in Philadelphia. And I think that is such an important thing we need to kind of think about when we're looking at this data, what this means and how we're translating it to the greater population and what assumptions we're making. And like that comment that individual just made, very likely we're seeing probably the same trends in an uninsured population.
Yeah, and so that's just the data nerd in me trying to make sure we're all on the same playing
I'm with you.
The numbers that we're looking at. So let's start with this overall trend, because this is kind of the baseline that we're looking at here. So talk us through what this graph is showing us.
So this was out of the 2019 report. And so really what this was trying to convey was that when you evaluated the data, and so the data included people who were not just of millennials, we were comparing the millennial population as you previously defined in those age ranges to other generations, Gen X, baby boomers, et cetera. And when looking across all of the generations, we saw that there started to become a decline in health for millennials at the age of 27. So meaning that there started to be an uptick in certain diagnoses at that time. And we can move to the next slide. Yep. So what this report revealed is exactly what this headline says: unexpected and alarming health trends. So we found that across this population that was studied initially, there were kind of 10 top health conditions identified for them. 6 out of 10 of these are actually behavioral health conditions, with major depression being number 1 for all of them. And then they also included some chronic health conditions, hypertension and type 2 diabetes, which was actually very shocking to see those diagnoses in such a young group of people. Typically, those are diagnoses you see later on in life, but quite scary to see that we were seeing so many young people kind of have these chronic illnesses that were only setting them up for further issues later in life. 8 of these 10 health conditions saw double-digit increases in the prevalence during the study time, from 2014 to 2017. So also really interesting that as younger millennials aged into that same group, we were seeing that they were picking up the same diagnoses. And so it really prompted this, well, why is this happening and what can we do? A last point on this slide also is that compared to Gen Xers at the same age, from 34 to 36, millennials overall demonstrated worse health by 11%. So we were already seeing that this wasn't just kind of unique trends happening in this group. There was a definite difference between millennials and other later generations. And you can go to the next slide. Now, this data actually came from the 2020 report and showed that those with a diagnosis of a behavioral health condition were twice as likely to have a chronic physical condition, such as hypertension, type 2 diabetes, as compared to their peers that did not have a behavioral health diagnosis. So this kind of really helped us drill down a bit and say, okay, there's a definite connection between behavioral health and physical health, which people have talked about for years. But this, like to your point about being data, this is the hard science that's showing us this is a really big issue. And what are we going to do about it? Also in this slide, sorry, you can get back for a second. We saw that compared to the 2019 report in general, there was a 12% increase in major depression, a 7% increase in alcohol use disorder, a 5% increase in tobacco use disorder, and overall 92% of millennials said that COVID-19 had a negative impact on their mental health. So while we were already seeing a kind of poor outcome for this generation, the impact of the pandemic certainly weighed heavily on this group.
So just before I move on to the next slide, what these numbers are showing is before the pandemic. And so
correct.
Right, and so the pandemic is only exacerbating these.
Correct.
Got it. And then the last bit of data that we want to talk about here, I think is a really important one.
Yeah, so this is actually, I think, a great slide to set up the rest of this conversation, because what this is showing you really is major differences in behavioral health diagnoses by race and ethnicity, really pointing to the evidence that could support underdiagnoses in communities of color due to a variety of reasons. And so cultural differences, stigma, barriers to access to care, there are so many reasons, there's not just really one, that's kind of creating this huge difference between different groups of color. But I think it's going to be very interesting to kind of see how different geographic areas are putting in kind of controls and efforts to identify those who are, this is again back to the uninsured, those who are not seeking care, because there is a large group of those people who don't have a diagnosis, but probably do need to have a formal diagnosis and be cared for. And you know, in Philadelphia alone, we have large communities of color, and so important for us to kind of be looking at them and finding out ways that we can be helping them. It's not going to be a straightforward path for everyone to how they get care, seek care, or choose to actually initiate it. We all need to kind of be coming together to really identify ways to help all these individuals.
So I think that's a really important point you make there, is that these data in some ways are really only the tip of the iceberg. That they are telling a story that's concerning and that requires a lot of attention, but there's so much more that these data are pointing us towards that we don't fully understand yet. And that's why it's so important to start to dig deeper to see what are the stories and the experiences that are underlying these numbers. So with that, thanks for walking us through some of that, that high level of the story here. But I'd like to pull in Lauren and Alonzo into the conversation now, because both of you, work at organizations that are really seeing the impact of these numbers and what those mean for real people. And maybe we can start with that interconnectivity between mental health and physical health. What does that mean for the communities that you serve? And I'll throw that question to Lauren first.
Thank you, Jatri. Thanks so much for having me, to you and the Franklin Institute. Glad to be part of this conversation today, and thanks, Kanika, for that data. And I think you hit the nail on the head when you said that we've had this long-standing assumption or sort of theory that there was this interconnectivity between physical and mental health and behavioral health, and that data really points to how true that is. At Public Health Management Corporation, or PHMC as we refer to it, we have been in existence for about 50 years, and we have longstanding experience serving the greater Philadelphia region. So we serve some of the most underserved and vulnerable communities across our region, many of whom we serve are underinsured or uninsured. So that their data is likely not represented in some of what you presented. But we see these trends that you've so clearly outlined, and we know that there's an interconnectivity between someone's overall health and well-being and how mental health is a key contributing factor, and one of multiple factors that really contributes to someone's health and wellness. So a cornerstone of what PHMC does is we look at that interconnectivity between physical health and behavioral health very intentionally across 5 of our health centers that serve the city. And we have behavioral health social workers, and we have case managers, and we have sort of a very intentional approach that when someone's coming in for a physical condition, we have a set of questions, a screening, sort of an assessment of such, where we're trying to get a sense of all of the multitude of factors that contribute to who they are, who their family is, what it's like to be within the community that they live, and how that contributes to their health and well-being. And oftentimes mental health conditions or an early stage diagnosis may present. And there's also many other factors that can be identified, where there's opportunity to, help someone in the social circles they're in, or with, parenting strategies, or, financial stability and wellness. There's an interconnectivity of all of these components that contribute to, how someone feels mentally and then also physically. I think one of the pieces that's so striking is the decline of health on the chart, Karnika, at 27. That should alarm all of us. And I think what we all probably know through either experience or just through sort of life trajectory, that at 27, to have your health decline when oftentimes heavier responsibilities come across your plate, whether that be parenting or contributing to the health of parents that may be aging, or paying bills in a different way or a particular way. So let alone what the last year pandemic has done to millennials and those around us. So that's how I would answer that question in terms of how we see their interconnectivity. And it's really just the tip of the iceberg, like you had said, to a longer conversation on those factors.
And before I turn it over to Alonzo, I think what maybe some of us might be seeing just from our personal experience is that when we look at kind of physical health care, for me most recently is I've had ACL knee surgery, but I've noticed that there are questions about my mental health that are integrated into my care for my knee surgery. And is that an example of how we're trying to kind of integrate mental and behavioral health care along with physical health care, and so we there fewer people fall through the cracks maybe?
I think absolutely yes. And I think it's incumbent upon, providers certainly, but also community-based organizations and others to look at touch points in serving the community as ways and examples to helping people in all aspects of their life. And I'm sure we'll get to this as part of the conversation, but really destigmatizing, the mental health and more, probably a better way to say it is normalizing the conversation, having a more, transparent conversation about how it's okay to discuss mental health challenges, and maybe generationally our parents or sort of older generations or outside of the millennial generation didn't talk about it so much, but to normalize that conversation in multiple aspects of life, I think is a step in the right direction, because we're not always seeing people come into our settings and saying, I believe I have a mental health condition, can you help me? Some people are, certainly, but oftentimes they're saying, hey, I need help paying my bills, or hey, I need help with some parenting strategies, or I have this physical ailment. And then it's upon those questions sort of that you just referenced, or those opportunities to connect with a social worker or a case manager, where there's identifying risk factors or other conversations that may come up and lead to a more productive conversation about wellness.
Thanks, Lauren. So Alonzo, I'll turn it over to you now, because you're from the Children's Hospital of Philadelphia. That's not generally what we think of when we think of that population between 1981 to 1996, and yet you see this in a very in a very important on the ground way as well. Can you tell us a little bit about what your work deals with and what factors you're seeing that might underlie some of these trends.
Sure, Jatri, and thanks for having me. So yeah, you're right. Children's Hospital of Philadelphia, we are a pediatric hospital, so our patients are not aged 25 to 40. They're not millennials. They're primarily minors. But we recognize the importance of parents and caretakers in the health of their children, and so we really think about millennial health from an intergenerational health perspective. And recognizing that if we want the child to be healthy, we need to be asking questions about that caretaker and how are they doing. And so that's really how we think about millennial health, just from the parent perspective, because they're not our patients, but they are our patients at the same time. I really enjoyed the conversation we were having because so much of parent health is it is about just having the question, right? And so I think what the Well City Challenge is focusing on, food and nutrition, mind and body, community, social connection, those are all important health needs for CHOP. They're important. They've been identified by the communities, prioritized health needs. So these are the issues that our community is saying they want us to focus on, specifically around mental health. For pediatrics, the conversation about embedding, we embed behavioral health care in our primary care practices. We have a department of psychiatry that actually has practitioners in our primary care centers. We have different community non-CHOP organizations embedded in our kind of co-located in our primary care centers. So we address that for our patients. For adults, what we're starting to do more and more is this conversation that Lauren was having before, involving the caretaker in the actual delivery of care, right? And so with one of our newer programs, Healthy Together, we actually, in some programs, require, in other programs it's optional, a caretaker be present when we're providing virtual group therapy for a child. And so that family member is involved in the process because they're so key and pivotal to that child actually getting the care that they need. Another thing that we're doing, and is again similar to what Lauren was talking about, is sometimes families are not ready to address behavioral health because there's some other pressing need. I'm facing eviction, right? I don't have enough food on the table. I have an asthmatic child and there's a leak in my house, and that leak is actually exacerbating my child's asthma condition. And so it's very difficult to have a conversation about mental health if this it's like Maslow's hierarchy of needs, right? If my basic needs are not being addressed, I can't have a conversation about this higher functional issue. And so we're even using our social work and care, kind of different roles, community health workers, addressing families' social needs first, right? So they tell us these are the needs. Hey, I'm struggling with online learning, virtual learning, or I'm facing eviction. I need some support here. So we meet that need first, and then that creates the relationship that takes that immediate pressing need off the table, and then we can have another discussion about behavioral health for the child, or even if it's a referral for the parent. And so this is an issue that is top of mind for us because the community has identified it, but we're just learning more and more, or investing more and more in addressing some of these other issues that are causing stress and anxiety in our parents and caretakers' lives.
And some of these factors that you mentioned, Alonzo, I think that these are really being recognized in the study of science and health much more today than they might have, even 10 or 20 years ago. We now call these social determinants of health, to think about all of the ways in which our environments and behaviors and these external factors influence our health that goes beyond just our genes. And so having this kind of full picture of health is really important for thinking how we can keep communities healthier. So thanks for sharing about some of those programs that you have in place to really take this holistic view. So Nick, that brings us to you. We've kind of seen some of these data that are showing these trends in millennial health. We've heard from Alonzo and Lauren about what they're seeing on the ground. Tell us a little bit about the Economy League and what you do, and where you see an opportunity for innovation in the face of this challenge.
Sure, thanks, Jatri. And again, thank you and to the Franklin Institute for hosting this discussion. Thrilled to be here. And thanks to my colleagues for joining as well. So just quick blurb on the Economy League for those in the audience who may not be familiar with us. We're an independent nonprofit in Philadelphia here. We like to call ourselves the region's think and do tank. So we do independent research and analysis, and we also run programs that are all pointed at trying to stimulate and sustain inclusive growth in the Philadelphia area. We on the Well City Challenge have been working closely with Independence Blue Cross, which is the presenting sponsor of the Well City Challenge, because we recognize that population health has a deep tie to the vitality and health of our communities and our economy, right? So 1 in 3 Philadelphians is a millennial. I'm one of them. I actually recently learned that I am a geriatric millennial, I am to call myself, which makes me feel like I'm in poorer health than I probably actually am. But so this is a huge population nationwide, but it's also a third of our population in Philadelphia. So as the health of millennials goes, so goes the health of our communities and our overall city and metropolitan economy. And of course, in the face of big population health challenges, there's going to be a need for kind of healthcare and medical interventions. There's going to be a need for government policy interventions. But we believe that there's also a really important role that the community and communities can and has to play in driving solutions, because as we've touched on already in this conversation a bit, the barriers to health access and to health equity are different in different communities. There is no real one-size-fits-all solution. So it's important that community members are engaged and empowered in helping develop some of the solutions to the broad challenges for millennials that we've heard about. So we have a suite of programs at the Economy League that's called Impact Labs, and it really kind of takes a page from the kind of innovation playbook that you find in high growth industries like tech or biosciences, and it applies it to the work of social impact. So what we essentially do is run a kind of an incubator or an accelerator that connects what we like to call everyday innovators, members in the communities in and around Philadelphia, with the resources and support they need to be able to scale early stage innovative social ventures. And so the Well City Challenge is focused very specifically on improving millennial health. Alonzo mentioned earlier that we have kind of 3 themes that we're specifically focused on: food and nutrition, community and social connection, and mind-body, so the physical fitness and mindfulness side of things. So we started the Well City Challenge last fall. In all honesty, this was a program that we had been planning prior to COVID, and we were going to run it in person, but of course, like many other things and many other programs, we were forced to delay things a little bit and then run them virtually. But we put a call for ideas out to the community in the fall. Had over 100 applications from social entrepreneurs and innovators from 51 zip codes around the Philadelphia area. And we did the hard work of kind of shortlisting, sorting through all those applications, shortlisting them to a group of 15 that represented a really diverse group of ideas and solutions from all around the city and the region. We worked with them. Those 15 teams pitched at pitch competitions after participating in a very rapid, intensive incubator to help them kind of refine their idea, where we paired each team with advisors, experts and professionals who could help refine their idea. And 5 teams emerged from those pitch competitions in early March. We had about 1,000 people attend those pitch competitions via Zoom. And now we've been working with 5 teams, 5 really incredible and innovative social ventures that really focus on a range of different angles towards improving millennial health. We've been working on them in an accelerator where we've been connecting them with some money. Each of these teams won some money out of the pitch competitions, some knowledge through an intensive curriculum that's focused on business planning and refining their model, and then with networks. So folks represented here, as well as a broader advisory committee and suite of experts that can help these teams connect their ideas. So what we're really trying to do at the end of the day is make space for kind of community innovation to empower community members and support them in designing and delivering solutions to millennial health challenges that may not necessarily be getting the attention or the kind of customized support that they need from broader policy or kind of healthcare system interventions.
That's a great point, Nick, because I think what we're talking about is illustrating how, even though our story starts with this kind of focus on health, that ultimately this is such a multifaceted problem that even though science and health and tech can all play a role in this, ultimately it affects communities, and communities have solutions themselves that sometimes science doesn't always give a voice to. And so it's great to have programs like this that, not only welcomes, but then, supports and promotes these kinds of innovative solutions. So as we continue our conversation, I'll throw out two questions to folks in the audience. One is, if you're willing to share some of your own experiences about how some of these ideas resonate with how your life has been over the last couple of years, especially through the pandemic. We'd love to hear how you're making that connection. And also, as you're facing these challenges, how do you tackle them in your own life? What are your community solutions, that you're coming up with to try and figure out the way forward as we start to emerge from this pandemic? So with that, let me come back to our panelists here and ask you maybe the same question here. Is that, are there individual stories that you've heard as you've been having this kind of conversation on a high level that start to capture what this challenge means for individuals? And Kernika, maybe I'll start with you, because I had the good fortune to be part of one of the listening sessions that you held to kind of follow through on the report. And so maybe there's something that you can share from one of those.
Sure, yeah. So I'll start kind of just with the a general understanding of what listening sessions were, so everybody tuning in can have an appreciation for it. But we, with the launch of the report in 2019 in April, we held a listening session here in Philadelphia. We gathered a group of providers, community leaders, medical students, and others, millennials, to come together and really discuss the findings of the report and what that meant to them, and are they seeing that in their day-to-day, in their practices, in their worlds, in their lives. And it was all a resounding yes. We hear this, we see this, we feel this. And we took that kind of model for the listening session and we took it on the road with the Blue Cross Blue Shield Association. And so we pretty much traveled the nation over the next few months, then listening to different people and stakeholders in different parts of America. And so I had the good fortune of being able to go to many of them. And I will say that probably the most interesting ones that I went to were in most rural areas in America. So Idaho, Iowa. I think in Idaho, I had probably the most interesting time there, listening to people coming from communities all over from a distance. And I remember in particular, one individual was a woman. She was young, she was a millennial herself, she was a nurse. And she was speaking about how in their very small town, the rate of suicides had started to increase incredibly. And it was becoming like, a public health issue for them at that point. And she said that she was seeing young people every day coming in with attempts, and it was horrifying to her, people her age, people who were her friends. They had never seen something like this before in this area. And so, it became a really big emergency for them. And I remember sitting there listening to her saying, I have no idea, this was happening here. This has gotten no attention, no, press, nothing. And it's a huge issue in such a small town, such a large population was clearly incredibly affected. And the resources just weren't there. And so it was really eye-opening for me, because you sit in your bubble and you know the issues going on in the world, the issues happening maybe in your community, but then when you go somewhere else and you're like, this is a really big problem, what is anyone doing about this? And so I think that hearing stories like this and so many more for Independence Blue Cross, this really nailed it for us, and why we wanted to partner with the Economy League to kind of find community-led engaging solutions for how do we curb this? How do we stop this from happening? Because I think no one knows better than those living in those communities. Those of us in all these great organizations, we can put forth great ideas, but unless we're listening to people out there in the communities living this day to day, we're probably not going to find a solution on our own without them.
I want to jump in here and just say that I think this is a good, following that story, it's a good time to point out that we are lucky to have a lot of resources here in Philadelphia for people who need help, whether it's just community services or whether you're having a crisis. And our panel has put together a number of resources that are available if you need help. And we shared those in the comments section. So, so please go ahead and, if you're having trouble of, and need help, please, those resources are here for our community. And we've also shared information on the Well City Challenge as well. So thanks to our team here behind the scenes for sharing those out. Can I ask any others? And one of the things that we talked about in particular was with the pandemic is many of our healthcare workers are millennials, and what kind of stories are we hearing from them from this intersection of risk factors here?
Yeah, I can take this one, Jatri. Yeah, I mean, CHOP has 20,000 employees, and similarly, a lot of our employees are millennials. I think for us as a hospital, it's kind of a double impact. I think because not only everyone's impacted by the pandemic, but a lot of our workers are frontline workers, healthcare workers, and I think there is just a high level of stress and anxiety that everyone's feeling. I think healthcare workers can feel it a little bit more acutely. And so, I think as a hospital, we've been very intentional about investing in our support services and just wellness services. And just, it's the services, but also just, I think Lauren mentioned, it's just the acknowledgement, right? I think so many times doctors, nurses, healthcare workers, we how do you make it part of the culture that it's okay to say I need help, or it's okay to say I'm stressed? And so just normalizing that even within our own culture. Just saying it's okay to raise your hand and just say I'm overwhelmed. And so we've been very intentional as a hospital about just having the conversation, because as human beings, we're just not built for this amount of stress for this prolonged period of time. We're just physically not made up for it. And so at some point, everybody starts to show wear and tear, in addition to just life happening, right? But just life happens, right? People are dying because of COVID. The murder rate in Philadelphia is very high. And so we have people living in communities that have a very high gun violence rate. All the other issues that are happening because of the pandemic or exacerbated by the pandemic, all the issues we've seen with racism over the past year, just people are just dealing with a lot. And so just as an employer, just doing right by our employees is something that we've been very intentional about for over the past year and a half, especially.
So a couple of you have brought up this idea of normalizing the conversation, and I'm hopeful that the more we talk about this, that just like the frequency of the conversation can help with that. But Nick and Lauren, what are you seeing in terms of how people are talking about mental health and how that maybe is changing from how we've talked about it before?
I'll jump in more on sort of the personal experience than professional, if I will. I know you sort of asked for people to give their personal input as well. As a mom of two young children, and my children clearly aren't millennials, being so young. At the same time, in their school environment and in the community environment, since the onset of the pandemic, I've been really grateful for the shift in conversation than the previous year in terms of what matters most right now. And it's the health and well-being of children and individuals and families, and how to get families through school and with the right supports. I've had conversations with my daughter's teachers where they're asking how my husband and I are doing, professionally and personally in support of my kids' schooling. So I don't know if that answers your question so directly, but I just feel like this year has sort of thrust a lot of these hot topics very much into the spotlight. And it's been an unfortunate year in many different ways. At the same time, I think, we're human and we have to take hope and build resilience from this. And I think if we can sort of take some of these, key topics and look at this as a step in the direction of normalizing a conversation that's going to better individuals, families, and communities, then hopefully we can sort of be headed in a better or more productive direction. We're certainly seeing it similar to what Alonzo said in terms of normalizing mental health awareness and supports and sort of, how to take care of yourself as you're taking care of others. We see that on the workforce front as well. And then just like I said, personally, I just feel like people are talking about it more, and not in sort of a whisper sort of way. I'm okay with talking about that I get help, or that I'm seeking help, or that I'm in need of help, or maybe I don't know what I need help for, but it's okay to not be okay. It's okay to sort of, acknowledge the challenges of this last year, and put one foot in front of the other with, some support.
And maybe just a quick, I think Naomi Osaka, the tennis player, one of the best tennis players in the world right now, Lauren, to your point, right? Whether you agree with her position or not, has really elevated that conversation around, and she's not a millennial apparently, she's 23, but it really elevated the conversation around the importance of taking care of self. And just Lauren, as you were talking, I was thinking about this importance of taking care of the person who's taking care of the children. CHOP, we also are partnering with some out of school time operators in West Philadelphia to support staff, right? Because I think staff who are there, teachers, school-based staff who are there to support children, they're going through a lot. And again, how can they be their best selves to support children? And so we actually have experts at our hospital with the Center for Violence Prevention who are actually training staff on how to manage their stress, how to deal with anxiety, how to support children that are going through trauma, and how to recognize certain signs, how to talk to families, right? And so I think just recognizing that whether it's the healthcare worker or the teacher or the parent, we all need our support. Again, we're very focused on the child, but who are all the people around that child that need to be their best selves to take care of the child? And so those are just some programs that we're doing. But Lauren, just your comment made me think of that.
Yeah, thank you. I agree.
Yeah, and I agree that within the past year, obviously the intensity of what we collectively have gone through, some much more than others, has resulted in somewhat of a change in kind of willingness to kind of elevate this conversation. And I mean, that's manifested itself in a bunch of different ways in my life, but through the Well City Challenge, we're trying to kind of walk the talk. And so we're working with our 5 teams through this accelerator. We meet weekly, and we have carved out a portion of every meeting is a community check-in where folks can talk about how they're doing, right? That is becoming now part of our programming, so that we're not just kind of speeding past some of the, the context in which people are kind of presenting themselves at a certain meeting. And I think that's something that hopefully, we at the Economy League will be able to integrate more into our practices, and that will become more widespread going forward. And then, I think that in terms of normalizing the conversation, I think each of the 5 teams that we're working with right now, to one extent or another, is doing that. And I won't, go into great detail because each of these 5 teams will be presenting their ideas for a chance at winning a $50,000 prize on July 7th at what we're calling the Well City Expo. And I think we'll share some information on that. But just to give you a sense of the types of ideas, we have one woman who's working on a project to bring mental health first aid services to barbershops and beauty salons, primarily in the Black community here in Philadelphia, because it's such a social hub. We have another project that is run by recent immigrants to Philadelphia that's focused on creating a platform and a safe space for recent immigrants to come together, not only to get to know each other, but also to access resources related to behavioral and mental health and physical health. We have a running-based fitness club that's both kind of neighborhood-based, but also has a technology aspect, but links together that connection between physical health and mental health. There is a hyper-local project that is kind of a combination of community gardening, cooking classes, and a subscription box for food that is all plant-based, that is focused on the connection between what you put in your body and how you feel mentally. And then let's see, last but not least, we have, and I'm going to get dinged by this last founder here, I'm trying to run them all through off the top of my head. Did I do 5? I'll come back in a second. The point here is that we have a great diversity of ideas that's all about kind of elevating the conversation around mental health and health in general at the community level, and engaging, activating, and empowering those folks.
And I don't want anyone listening to this and say the conversation is just on normalizing. That tends to put it on the individual. We all agree access is extremely important. And so some of the things that Nick just spoke about, whether it's about bringing services to barbershops and salons, or some of the work that CHOP is doing in schools, after school programs, access is critical, whether it's, the type of insurance someone has, the location that it is, whether someone feels comfortable, gender, race with the person. I mean, there's a lot of things. Access is really important. So I just don't want anyone to think that it's a broad conversation, but access is a critical part of it too.
Yeah, totally. And I did forget one. And so if I may, I will mention there's a platform. It's a technology platform to connect experienced experienced Black women in the workforce with emerging Black women in the workforce, because we know that the Black women's experience in the workforce is unique and comes with its own set of challenges. And so that kind of matchmaking and mentorship between Black women in the workforce is critical to helping them navigate their way upward and also take care of themselves.
Yeah, I think actually both of those, points that you just made kind of work really well together, because it's this diversity of people and, and approaches that are working at these different levels as well. So, from that, from the individual to the more systemic access level. And I think that really just illustrates how we need to have this really, big picture approach to it. I think one thing that's really exciting to me, Nick, you were mentioning, just like the huge diversity of applicants to the Well City Challenge that came from, so many teams, so many communities, because, and this is all, I'm trying to tie all of our threads together here, because as Karnika pointed out that, every community has its own kind of, unique viewpoint that we need to be thoughtful about. For even just thinking about that program that you mentioned, with immigrant communities, like my own family, is part of an immigrant community, and we never talked about mental health growing up. And so seeing this kind of change is really exciting for me, to see how communities are coming together to not just change the conversation, but to change the resources and the access that's out there too.
Yeah, and one of the things I love about the Well City Challenge is just how you're empowering the community to come up with solutions for the community, right? I think that is a shift for our country, for our region, right? I think the community for so long has been wanted to be at the table and not just consulted after the fact, but at the beginning of the process, and be empowered to make decisions and actually be given the resources. And so I think initiatives like the Well City Challenge really help that, right? Because you can have the right strategy, but how it's operationalized can vary in this city from block to block, right? Not even neighborhood to neighborhood, because Philadelphia is such a diverse place. And so I think that is a trend. CHOP, we're definitely doing that, but I think more and more as I read about other initiatives, the role of the community in shaping strategies and implementing them is really growing. And I think that is a positive trend that should only continue in the city.
That community buy-in and trust is everything, right? And it's clear there's no shortage of interest in trying to, on the part of community members, to roll up their sleeves and get involved. This fall, mid-October to mid-November, was our call for ideas, like the craziest period that you could imagine. Middle of the election, during a global pandemic, we're all virtual. We had no idea how many applications we would get. And we were blown away by the fact that we got more than 100 applications from more than 50 zip codes around the country. So, there is immense demand on the part of community members to get involved and help contribute to solutions. And I think it falls to us to figure out how to build the kind of infrastructure to support that type of work.
I'll just jump in quick. I just completely agree with what Alonzo and Nick have been saying, and particular to the access and community driven solutions. I was had the fortunate opportunity to be a judge on one of the panels for the Mind and Body section of the Well City Challenge. And it was incredibly difficult to ultimately get to the group that we selected. And we all, the judges, pulled together and we felt strongly about who we selected. At the same time, all of the ideas were phenomenal, and all of the ideas had enormous potential to go on and to do great things, and hopefully they will. And I think that really speaks to both the need and then also the power of empowering individuals in these settings who know communities and the challenges and the data the best, because they're living it each and every day. So just a call to all the amazing, finalists, because the passion was just palpable and really exciting to listen in on.
And so on that note, I'll give everybody a sneak peek that we're going to have, hopefully some of the winners joining us for the conversation next month. So I hope, many of you will be able to join us for that conversation to find out what these community solutions actually look like, and the people, and meet the people who are driving them. And also in addition to that, Nick, you mentioned the Well City Expo on July 7th. That's a public event as well, right? How do people get involved?
That is a public event, and that's really the kind of shining moment, the culmination of the Well City Challenge, where each of the teams will have the opportunity to kind of display their idea. We'll have some panel discussions with the team members. We'll be talking about their experience in Well City. We will be awarding $50,000 to one team to help support their idea going forward. And we're also going to be giving out some prizes to attendees. It's a public event. It's free. You can register at economyleague.org/WellCityExpo. I think we have the link that we can share if we haven't already. And you'll get to meet and interact with these founders. So for those of you out in the audience who are interested in millennial health or interested in kind of social innovation and trying to figure out how to roll up your own sleeves and make an impact in your community, you'll have the opportunity to speak directly to folks who have been on this journey, and also learn more about some of the challenges that the millennial generation is facing on a health front. So we'd love to see you there, and then we'll have the kind of after party a few days later on this show, I think on the 12th, where you'll get to hear all the scoop and the gossip following the big show.
I'm really looking forward to hearing from all of these folks. But with that, we'll wrap up our conversation here today. Thank you, Kartika, Nick, Alonzo, and Lauren for joining us, for bringing your perspectives and your experience on this really important issue that we're facing as a community and as a country. Thank you all to everyone who's out in the audience joining us today. We really appreciate you and your perspectives as well, and we look forward to continuing this conversation next month. Thank you so much, and we'll post this on YouTube as well if you didn't catch it or you want to share it. These conversations do get archived, so please share widely. Thanks so much for joining us virtually here at the Franklin Institute. We hope you do take a chance to visit us in person soon, and we'll talk again. Thanks, everybody. Take care.